The Committee on Homeland Security will come to order. Without objection, the chair is authorized to declare the committee in recess at any point. Good morning. Today, the committee is meeting to examine how the federal government can ensure equity in disaster preparedness, response, and recovery. Last summer, almost 1 in 3 Americans experienced a disaster. Disasters are increasing, and as they do, the number of people in need of assistance will always increase. However, not everyone who needs assistance will get in. In fact, those who need it the most are often the least likely to get help. Some believe that disasters are great equalizers. To the contrary, disasters expose and worsen inequities in part because disaster assistance programs favor some groups over others. For example, internal FEMA analysis reported by NPR showed that low-income applicants were twice as likely to be denied FEMA housing assistance due to insufficient damage. These outcomes lead to long-term impacts that are detrimental to already marginalized groups. Put simply, a growing body of evidence shows that in the wake of a disaster, the rich get richer and the poor get poorer. Race always appears to play a role in outcomes. According to a 2018 study, white Americans living in counties that receive disaster aid gained over $100,000 in wealth compared to white Americans living in counties that did not experience a disaster. In contrast, Black and Latino Americans in the areas that received disaster assistance lost thousands compared to their peers that had not experienced the disaster. A person's zip code or skin color should not affect how he or she fares in a disaster, but this is exactly what happens. Low-income and rural communities are especially at risk. The Federal Energy Management Agency is aware of these inequities. In November of 2020, FEMA's own National Advisory Council delivered a stunning rebuke of the status quo, stating, FEMA does not meet the equity requirements of the Stafford Act. The Advisory Council defined equity as to provide the greatest support to those with greatest need to achieve a certain minimum outcome. Equity in recognizing and responding to different needs to ensure everyone can recover with dignity. That means making sure that we do not leave rural communities behind, supporting community members with differing abilities, as well as protecting everyone's right to a safe recovery, regardless of their race or ethnicity or their income. I commend the Biden administration for working to ensure equity in FEMA programs, including expanding allowable ownership documentation to help families with heirs properties keep land that has been in their family for generations. These are important steps in the right direction, and we must press on. Now is the time for bold action. It's time to rethink a system that too often failed those who are already marginalized. I've seen the effect of the status quo on the communities with my own eyes. In June, floods devastated the Mississippi Delta. Over 700 homes were impacted, yet residents did not receive assistance. These families had inches of water in their homes, and after 30 days were informed by the state that the governor would not even pursue federal assistance. The Stafford Act relies on governors and local leaders to act in good faith, but this may not always be the case when it comes to certain communities. I'm certainly working on legislation to help address this problem and looking forward to introducing it in the near future. I also encourage DHS to continue making progress toward equity where it has discretion to do so. It is time to change inequitable policies throughout our disaster response system. Today, we'll hear from our witnesses why these inequities exist and what we can do about them. I look forward to your testimony. I now recognize the ranking member, the gentleman from New York, Mr. Katko, for an opening statement.
Thank you, Mr. Chairman, and I'm going to echo your sentiments that with respect to FEMA disasters, I think your quote was something along the lines of those who need it the most are often least likely to receive the aid. I couldn't agree more. Sometimes I think it's a formulaic thing. In upstate New York, we've had multiple disasters, and none of them have qualified for FEMA assistance, and I'm going to talk more about that during the hearing today. But I do think the formulas are something that we need to look at as well, because that seems to reinforce some of the concerns that you have. So I do want to thank you for holding this very important hearing today on equity and emergency management. I'm thankful for the opportunity to discuss this topic and look forward to hearing from our witnesses. Unfortunately, disasters around the globe have historically had greater negative impacts on lower income and minority populations. The reasons for this are complex and numerous. Some of these reasons include minimal investment in infrastructure before a disaster, lack of insurance or underinsurance, inability for those in disaster-prone areas to flee when or before a disaster strikes, and a philanthropic gap after an event. All these factors and more contribute to added negative impacts on the front end of a disaster, as well as slower and less effective response and recoveries after disaster strikes. These factors also, unfortunately, contribute to pushing more individuals and communities that are already on the brink into further poverty and despair. According to a 2017 article in Scientific America, in the United States, quote, each big catastrophe like a hurricane increases a U.S. county's poverty by 1%, 90 years of data show, end quote. In the United States, we have seen this phenomenon of greater short and long-term damage to lower income and minority areas play out through some of the country's worst disasters. And these impacts can sometimes be extremely long and lasting and permanent. 10 years after Hurricane Katrina hit New Orleans, 96,000 fewer African Americans were living in New Orleans than prior to Hurricane Katrina. Nearly 1 in 3 black residents had not returned to the city after the storm. And the median black household in New Orleans in 2013 was $30,000, which is $5,000 less than it was in 2000, adjusted for inflation. We see the impacts of disasters on these individuals and communities, not only in the United States, but across the world, where those already in poverty are disproportionately impacted by disasters. According to a 2016 World Bank report, some 26 million people are forced into poverty every year as a result of natural disasters. A 2008 report from the United Nations stated that of the 262 million individuals affected in 2007 and 2008 by natural disasters, 98% of those people resided in developing nations. That's the poorest of the poor. Mr. Chairman, like you, my district in Central New York also includes low-income and rural areas that may be disproportionately impacted by disasters. I know that both of us, if and when disaster strikes back home, would want assurances that all of our constituents are being treated in an equitable manner. These statistics from the United States and around the world are very eye-opening, and unfortunately, as I stated before, this phenomenon is not limited to one type of disaster, or even only to natural disasters. Disadvantaged and minority communities were also, and continue to be, hit particularly hard by COVID. According to a recent article in Healthline Media, quote, researchers report that the death rate from COVID-19 is significantly higher in Black, Native American, and Latino communities than any other groups. They say some factors are underlying medical conditions, unequal access to healthcare services, and jobs that require employees to work closely with the public, end quote. Additionally, in an article published by NBC News a few weeks ago, quote, since the pandemic began, about 1 in 434 rural Americans have died from COVID, compared with roughly 1 in 513 urban Americans. And though vaccines have reduced overall COVID death rates since the winter peak, rural mortality rates are now more than double that of urban ones and accelerating quickly, end quote. This death rate is also directly correlated to counties with a high rate of poverty, according to NIH. Mr. Chairman, I appreciate you having this hearing and shedding some light on this issue. I will say that I think we can do better, not only in the government, but in other organizations, such as nonprofits, community-based organizations that work on these issues. Since our focus today is on emergency management, I would like to simply challenge emergency managers, as I have in the past at all levels, to keep these anecdotes and statistics in mind as they work with communities on a full range of assistance, from pre-disaster mitigation to flood insurance to post-disaster assistance. We need to level the playing field and ensure that we are not only offering the same type and amount of assistance to everyone, but that emergency managers are considering the unique needs that certain communities and individuals have so that we can improve outcomes for all disaster survivors. I know that FEMA has recently taken steps to help ensure equity in disaster assistance, including the formation of an equity enterprise steering group and the establishment of a robust stakeholder engagement process to develop FEMA's 2022 to 2026 strategic plan. The Equity Enterprise Steering Group focuses on assessing issues such as access and delivery of FEMA programs, activities, and services. I hope these initiatives and others allow for greater access and inclusion in FEMA programs. We should consider ourselves very fortunate to live in a country that has the resources and programs to help our communities and individual citizens before, during, and after disasters. That is certainly not the case in all countries around the world. We also have tens of thousands of professionals dedicated to the field of emergency management and related fields, including our witnesses today. I look forward to hearing from them and how to better achieve equity in emergency management to ensure that all Americans and the communities they live in are able to mitigate, prepare for, respond to, and recover from any and all disasters. I will say before closing that I'm sick and tired of seeing people building multi-million-dollar mansions on the beach and then getting FEMA assistance while people in rural areas don't get squat. And we've got to change that, and that's what I'm interested in talking about today. And with that, Mr. Chairman, I yield back.
Thank you very much. I couldn't have made a better example than the million-dollar mansion on the beach.
Absolutely.
Absolutely. Other members of the committee are reminded that under the committee rules, opening statements may be submitted for the record. Members are also reminded that the committee will operate according to the guidelines laid out by the chairman and ranking member in our February 3rd colloquy regarding remote procedures. I now welcome our panel of witnesses. Our first witness is Dr. Lori Peek. Dr. Peek is director of the Natural Hazard Center and professor of sociology at the University of Colorado, Boulder. She's an author and expert on vulnerable populations in disasters and has conducted field investigations on the aftermath of the 9/11 terrorist attacks, Hurricane Katrina, the Joplin tornado, Superstorm Sandy, and Hurricane Matthew. Our second witness is Chauncey Willis. Ms. Willis is co-founder and CEO of the Institute for Diversity and Inclusion in Emergency Management. She's a certified emergency manager, a master exercise practitioner, and author, and served as emergency manager in Tampa, Florida for over 14 years, where she established programs for marginalized communities. Our third witness is Christopher Curry. Mr. Curry serves as the Director of Homeland and Justice Division with the U.S. Government Accountability Office. In his role, Mr. Curry leads GAO's investigative work on emergency management, disaster response and recovery, and management of the Department of Homeland Security. Mr. Curry began his tenure with GAO in 2002. Our fourth and final witness is Mr. James Joseph. Mr. Joseph is the Vice President of Response at Tidal Basin. From June 2020 to January 2021, he served as the Federal Emergency Management Agency Director of External Affairs. Previously, Mr. Joseph served as FEMA's Region 5 Administrator. Thank you for your participation here today. I look forward to all of your testimony. Without objection, the witness's full statement will be inserted in the record. I now ask each witness to summarize their statement for 5 minutes, beginning with Dr. Peek. Dr. Peek, are you on mute?
Now, Chairman Thompson.
Yes, Dr. Peek.
Okay, apologies. Thank you, Chairman Thompson and Ranking Member Katko for the invitation to testify. Disasters now directly affect tens of millions of Americans annually. Between 1960 and 2019 in the US, Natural hazards contributed to an estimated 35,000 deaths and more than 1.1 trillion in property and crop damage. During the same period, every single US county has experienced some loss due to natural hazards. We are all living with risk, but these risks are not felt equally. Decades of social science research has shown that disasters disproportionately affect the most marginalized among us. People living in poverty, people of color, women, children, older adults, and people with disabilities. Entire books are filled with examples of the unequal impacts of disaster. At present, however, many government programs do not consider equity in providing aid and therefore can actually deepen pre-existing inequalities. This leaves already vulnerable people even more at risk. For example, a recent study by Drakes and colleagues revealed low levels of post-disaster aid disbursement in places where households have high levels of social vulnerability, specifically those in rural areas, renters, the unmarried, Black and Asian Americans, and those with low incomes receive less aid. In their examination of more than 41,000 residential properties in 500 municipalities across the US, Elliott and colleagues found that flood damage is not the only predictor of where buyouts occur. Racial composition matters too, with whiter counties and neighborhoods being more likely to gain access to buyout assistance, even though those in neighborhoods of color are more likely to accept the assistance. This ends in communities of color being more likely to experience demolition and relocation. A 2016 study by Carter discovered that only 117 of 566 federally recognized tribes had FEMA-approved disaster mitigation plans. This means that more than 3/4 of all tribes would be ineligible to apply for FEMA grants and therefore could not receive federal funding for disaster projects. We know that federal aid doesn't always reach those most in need. What is less clear at present is what mechanisms are driving the observed inequities across programs. Some explanations include that low-income and rural communities, communities of color, and Indigenous communities have a harder time competing for funding because of federal cost share requirements, lack of access to technical assistance, limited data availability, and cumbersome application requirements. FEMA has supported the mitigation match concept in an effort to overcome these long-standing challenges. But historical injustices and contemporary inequities play a large role in shaping the receipt of individual and public assistance. Puerto Rican and Black Americans, for example, are less likely to have clear title to their property, which can lead to the outright denial of aid. About half of low-income and minority households are renters, but our current disaster policy prioritizes private homeowners. Right now, the dedicated staff at our federal agencies are confronting an onslaught of ever more damaging disasters. In addition, they are busy auditing their programs and policies to advance racial equity and support for underserved communities. This vital process could lead to a fundamental reimagining of disaster aid, whereby the vulnerable people who are hit first and worst in disasters are prioritized. In closing, it is clear that inequitable policies and practices, even when designed in good faith and meant to provide much needed relief and assistance, can become a second disaster that further upends people's lives and leads to a deepening of disadvantage. If we truly want to reduce natural hazards losses, we must work fervently to reduce economic and social inequality. This will take sound science, political leadership, a larger and more diverse disaster workforce, and adequate financial support for government agencies and their community partners. It will also require serious investments in equitable hazard mitigation and climate adaptation programs that reduce exposure to disaster harm in the first place. Thank you again for the opportunity to testify today.
I thank the witness for her testimony. We now ask Ms. Willis to summarize her testimony for 5 minutes.
Thank you. Chairman Thompson and Ranking Member Katko and distinguished members of the House Committee on Homeland Security. Thank you for the opportunity to share information with you today concerning equity and disaster preparedness and response and recovery. Our organization, the Institute for Diversity and Inclusion in Emergency Management, comes to you to suggest that anti-poverty bias and discrimination against marginalized groups is as pervasive and deeply rooted in emergency management as the water is wet in the ocean. As we meet today to discuss disaster equity, there is one thing that we must keep in the forefront of our minds, and that is the plight of the disaster survivors. We must address the basic tenets of inequitable policies like the Stafford Act and understand and empathize with the suffering of the people and their perspective. Black, white, rich, poor, Democrat or Republican, we can all get behind humanity and the human perspective. Equity is about the people, not the numbers. We are dealing with two major issues. First, we are dealing with biased policies like the Stafford Act that don't benefit historically marginalized groups and in many cases harms them. Secondly, we are dealing with a workforce that has become accustomed to discriminatory behavior. Biased behavior becomes normal and seems acceptable when you have done it for so long, and in some cases, you've been rewarded for it. Now, my mother graduated from Tougaloo College and my father from Jackson State University in Mississippi. And so my family and I are very familiar with the daily behavior and disregard of a government that diminishes the plight of people of color. In times of disaster, when the policies are not equitable and fail to value all people equally, and when the workforce and volunteers bring their own implicit bias to the job, the outcome is disproportionate negative impact on the most vulnerable. Now, many states have historical disaster bias to contend with, where the very bodies of African American and indigenous people were sacrificed and in some cases used as sandbags while they were still alive to prevent flooding of white homes and businesses. In states like Mississippi, Alabama, Georgia, the Carolinas, and all over the country, the very soil still cries out from the blood and sweat of the enslaved and the indigenous. And the soil now cries from the tears of those who are still being mistreated and marginalized. Not only must they endure Mother Nature, but they must also endure the response of a country that is comfortable operating in a construct where two emergency management systems prevail. One that embraces the educated, affluent, and or middle-class homeowners, and one that everyone else must endure and that actively works against them. The policies must change and the workforce must be retrained. You cannot ask an entire workforce of staff, contractors, and volunteers to produce equity without first training them to understand and value equity. The outcome is performative equity, and that is neither impactful nor sustainable. It is easy to change a policy that is clearly inequitable, but it's much harder to change the mindset and behavior of the people that created and enforced that inequitable policy. Equity is not easy, and it is not fast, and it requires a true, meaningful commitment to change. My goal here today is to save lives and end suffering of our most vulnerable people. We can save more lives through allocation of more preparedness and mitigation funding in vulnerable communities. And we can end the suffering by ensuring equitable response and recovery that is prioritized in policy and practice. Thank you for your time.
Thank you very much. For the record, I graduated from Tougaloo and Jackson State, so you have excellent parents. Chair recognizes Mr. Curry for 5 minutes.
Thank you, Chairman Thompson and Ranking Member Katko, for the opportunity to be here to discuss GAO's work on equity and disaster programs. In recent years, there's been a huge increase in disaster spending at the federal level to confront more extreme weather throughout the entire country. Since 2005, for example, the federal government has spent over $500 billion on disaster aid to citizens and communities. These are huge numbers, but they don't tell the whole story about who gets disaster aid and the effect it has. As FEMA even notes, low income and rural areas, communities of color, people with disabilities, tribes, and other groups face barriers to accessing aid. These groups also do not recover as quickly if they recover at all. While there's not a lot of research out there that's definitive, we identified many studies that show how disaster aid can help these communities. Other studies show how groups may not benefit as much as others. For example, one study reported that the more FEMA aid an area received, the more wealth inequality grew along the lines of race, education, and home ownership. Another study found that U.S. counties with greater participation in the National Flood Insurance Program experienced fewer fatalities from flood events. Our work has also found a number of challenges across federal programs that can impact our most vulnerable populations. We recently looked at the largest federal recovery programs within FEMA, HUD, and SBA. We found that they all have begun some work to identify and address these barriers and disparities. However, our concern right now is that agencies lack good information to identify when access barriers or the disparities exist. Specifically, they lack data needed to analyze and identify these areas. For example, none of the federal agencies collected and analyzed demographic data from applicants for the purpose of identifying disparate outcomes. Further, we also found there's no systematic process across these agencies to determine if these barriers and recovery outcomes exist across programs and how they affect various groups of vulnerable populations. You can't fix what you can't identify or measure. Getting the right information and using it effectively will be a critical first step in this to ensuring more equitable outcomes for all disaster survivors. Our prior work has also identified areas where federal programs can be improved in order to help disaster survivors more easily navigate them. For example, we found that FEMA could improve its Individuals and Households program by helping survivors better understand their eligibility and award status. We also found that confusion often prevented survivors from continuing the enrollment process or mistakenly assuming they were denied when they might not have been. We made a number of recommendations to FEMA to help survivors better understand how to get assistance, including improving their award letters, communicating more information to survivors on their eligibility status as well. We've also found that elderly individuals and those with disabilities face challenges in obtaining assistance. Specifically, at the time of our report, FEMA didn't provide individuals with clear opportunities to disclose disability-related needs when they registered for individual assistance. We recommended that they do a better job of this, and they have since taken some action to do this. However, this is just a drop in the bucket compared to everything else that needs to be done. Now, to its credit, FEMA and some other agencies have acknowledged that this is a challenge that has to be fixed, and they are taking some action. However, I want to stress that these efforts are really in their infancy. In January, the president issued the executive order on advancing racial equity and support for underserved communities. Since then, federal agencies have rushed to look at their programs and identify what to do. Since this is a brand new lens, it's fair to say that there's confusion across the federal agencies on how best to do this and what standards to set across government. It's not going to be easy, and everyone won't agree, but based on our work, I think it boils down to several key steps that we can take right away. First, I think we need to define equity, determine what data we need to identify disparities, and we need to use it to change programs. Second, I think we need to integrate equity into key policies and doctrine. This is somewhat started, but I think this needs to trickle into strategic plans for agencies. I think it also needs to make its way into key frameworks such as the National Response and National Disaster Recovery Framework. And then we need to move to each program to identify potential barriers to the process and disincentives that prevent those most in need of getting aid. And I thank you for the chance to be here, and I look forward to talking about these issues in more detail.
Thank you very much. Chair recognizes Mr. Joseph for 5 minutes.
Good morning, Chairman Thompson, Ranking Member Katko, and the membership of this committee. My name is James Joseph, and I'm the Vice President of Response at Tidal Basin, a disaster management and recovery firm based in Alexandria, Virginia. I have been an emergency manager at the county, state, and federal level over the past 11 years, most recently as Regional Administrator of FEMA Region 5. I've had the pleasure of working with many of you, both in my role at FEMA, as well as in my current role at Tidal Basin, and it's an honor to speak with you all. I'd also like to take a moment during this month of October to honor all those that have been victim to, but more importantly, recovered from breast cancer. Women and men suffer from this disease, and I wear pink today to honor them, including my cousin Sue in North Carolina that beat breast cancer. She's a beautiful and wonderful human being, and her strength is a source of courage to many. The topic before us, ensuring equity in FEMA's disaster preparedness, response, and recovery, has been spoken about for years now, and it is my hope that we continue to act and take deliberate actions to help increase representation in the emergency management profession, but also continue to build equitable practices in recovering from natural or man-made events. As it relates to ensuring equity in disaster recovery, there are several recommendations in my written statement and actions we can take as a nation to bring timely disaster response and recovery, not only to communities that need them the most, but also to individuals and families that are struggling to make ends meet daily, let alone when a catastrophic disaster strikes. It is important for us also to realize and recognize that this is not just in the federal level disasters supported by FEMA, but also for localized disasters that are managed by each state or community. As such, there is responsibility to have equitable recovery from disasters, that state and local governments have policies and programs in place that help financially struggling communities, individuals with disabilities, and those that face additional hardships during times of disasters. While state and local agencies bear the responsibility to provide for their communities and residents, there are still improvements that can be made at the federal level as it relates to distribution of funds after the president declares a disaster. Some of those recommendations in my written statement are to streamline the application process for individual assistance by eliminating the requirement to apply for an SBA loan prior to FEMA authorizing a disaster claim. Streamlining emergency lodging services to allow individuals without traditional credit or modes of transportation to relocate from homes more quickly and allowing them to access lodging in their own communities. Reinstituting the Sheltering and Temporary Essential Program, or the STEP program, that allowed for temporary emergency repairs while families remained in their home versus needing to find alternate lodging, including emergency shelters, as long as their home was safe to be resided in. Equally important is the need to build a pipeline and provide promotional opportunities for individuals that mirror our nation's diversity. A few years ago, I had the opportunity, the honor of addressing nearly 200 individuals that before my eyes raised their hands and denounced their birth citizenship and pledged allegiance to these United States of America. As one of the first people to welcome my now fellow citizens, the look on their faces were both inspiring with pride and rich with joy. In my address to them, I shared how my parents, who were in the audience that morning, came to this country some 50 years ago and one day sat in the same seats that they were in. And that by God's grace and their hard work, in one generation, I was standing on the other side of the dais welcoming them. I told them that their children can be anything they want to be: homemakers, business owners, doctors, lawyers, elected officials, or even the president. But could they be the next emergency manager? Having been an emergency manager at the local, state, and federal level, I was most often the only person of color in the room. And at the local and state level, there were few or no women in leadership positions. Recently, there have been more minority and female leaders in emergency management, and I applaud that. But we must still prioritize diversity and inclusion in the hiring and promotion of individuals from all backgrounds and all identities. If we are not deliberate about diversity and weave it into the very fabric of our local, state, and federal programs, this will never be achieved. I championed programs to diversify the workforce while at FEMA and found the red tape of the federal hiring process to be the largest obstacle. I'm also proud to work for Tidal Basin and our CEO, Daniel Craig, who with Chauncey's organization, IDEM, created the first scholarship program for minority students wishing to enter emergency management. Solutions do not require years of additional studies or months of deliberation on policy. It requires advocates at the senior level of every agency to advise and guide leadership in building and promoting a diverse workforce. As I conclude, let me say that we must do everything in our ability to advocate for equitable programs, agencies, and departments, and to advocate for diversity and inclusion in hiring and promotion. And I feel that we should do so as if the future of our profession depends on it, because in my opinion, it does. Mr. Chairman, Ranking Member, thank you for this opportunity.
Thank you very much. Thank the witnesses for their testimony. As usual, we will have questions. I will start the process of questioning. All of us who are members of Congress have had or will have some disaster in their respective community. For the most part, the majority of us will have areas of high income, moderate to low income citizens. It appears those of us who've gone through a disaster that the bar is somehow higher for working class individuals or individuals who are in rural areas than it is for individuals in high income or urban areas. Dr. Peak, how would you suggest leveling the playing field so that Americans who are facing disasters can feel that their government looks at them as an American, not as some member of a particular class?
Thank you so much, Chairman Thompson, for that question. And I just want to acknowledge that I know your district in particular has been struck low recently by hurricanes, flooding, and several other disaster events. And so just thank you for holding this hearing today and again for that question. So I think one of the first things that is most important in terms of leveling the playing field is what is happening today. And so the fact that we're having this conversation and shining light on the fact that low-income communities, people of color, and other marginalized community members have the hardest time accessing this aid and oftentimes experience the most prolonged and protracted recovery processes. And so I think that acknowledgement is first and foremost. But second, from there, I think some of the ideas that have already been put forth by the other panelists are absolutely vital. That until we have data available that allows us to track and monitor the status of different communities and how they're faring in disaster, we're going to have a very hard time changing policies and programs that may be deepening these inequalities. So I think the data availability is absolutely vital, and then also keeping this focus on equity central throughout all of our programs and policies. Thank you.
Thank you. Mr. Curry, you talked about the data availability, but I understand that, but generally speaking, don't we already collect the data as an agency as we work through the disasters? What data are we not collecting that we ought to be collecting?
That's a great question, sir. So as you know, and I'm trying not to get too technical, but there are various factors that FEMA and the jurisdiction consider when they're developing a damage assessment and preparing the information that eventually goes to the president to make a disaster declaration. So several of those factors include things that should account for the things we're talking about today: the income, the unemployment, the poverty level, elderly populations, the disabled. The question becomes, how good of a job do we do during that process to make that justification? And I think the challenge right now, those factors are they're very vague, and it's up to the local jurisdiction and the state to come up with that information. I think there's a number of options we can look at. Some of it in legislation, but also some of this is in regulation. And FEMA could change, or other agencies could change. For example, we could look to further quantify or require more quantitative measures be included when we're making an assessment of whether there needs to be a declaration that would factor in the poverty level, unemployment, all the things that we're talking about. Right now, though, it's very vague.
That's very troubling. The fact that here we have communities that are suffering, and we're caught in the lurch between the lack of information by which those individuals who are in this disaster position have really nothing to complement their situation, but their particular situation. So, Mr. Joseph, since you've been a practitioner, um, what recommendation would you say that we need to do so that vulnerable populations cannot miss out on the particular resources that are available to more affluent communities?
Mr. Chairman, I think one of the criteria that Mr. Curry spoke about is looking at the localized impact, looking at what the level of impact is on that community. And I don't feel, having been a local emergency manager, a state emergency manager, or even a federal emergency manager, that we always look at that, because it's not easy to identify. It's not data that is always collected, but even when it's available, I feel far too often that we may just look at threshold numbers, the dollar figures that are associated with declaring a disaster. As a FEMA regional administrator, I advocated for communities. I saw firsthand as a state and local emergency manager what the impact are on those communities. So I believe that continued advocacy, as I've mentioned even within the federal government, to look at what the communities are facing and look at what the long-term impacts are. And does that community truly have the ability to recover? In many cases, they might through state and local assistance, but in many cases they don't. And I think that's where the federal government can assist further by looking at what those specific localized impacts are in those communities and providing assistance where it's needed, even if it's not through a presidential declaration, but by other means of federal assistance that could be available from the multitude of agencies that have disaster service and recovery programs.
Thank you very much. Chair recognizes the ranking member.
Thank you, Mr. Chairman, and I appreciate this very important hearing today. I just want to give a couple of quick examples before I follow up with you, Mr. Joseph, on what you just said, because I completely agree with you. There's a home in Syracuse, New York, in a predominantly African-American community, $60,000 value on it, because they hadn't had a flood in over 100 years in that area. But with the flood insurance program, they're now mandating that that home must have upwards of $3,000 a year in flood insurance, have to pay for a premium, which makes a house almost non-saleable, and it just puts more of a burden on an economically depressed area. I find it very hard to believe that if you do a proportional amount, that a $6 million beach house is going to be paying $300,000 a year in insurance, which you would have to pay if it was proportional. So I just think that the premiums they're charging on these low-income areas are not proportional to what they're paying in the fancy areas. And to me, that is a form of discrimination, and it is something that's not right and something we need to look at. Secondly, I'll give you an example of a town in my district, not a high-income town, very low-income town, generally speaking, rural area. They had 4 inches of rain in about an hour and a half, and it had catastrophic flooding for that town, millions of dollars of damage, didn't qualify for FEMA aid or disaster declaration. And then lastly, I'll note Lake Ontario shoreline had a catastrophic flood in 2 out of 3 years, 2 out of the past 4 years. Hundreds of millions of dollars of damage along the shoreline to homes, and a lot of these homes were blue-collar people who worked very hard their whole lives to get a little piece of heaven on the lake, and their homes were devastated by the flooding. Didn't qualify for FEMA. So to Mr. Joseph, to your point, I think that the formulas that FEMA has right now tend to favor shoreline communities and big-ticket disasters, and what they see as big-ticket disasters. But proportionally, the town of Moravia had to have millions of dollars of damage, which was more than their entire budget by far, didn't qualify. So I'd like to drill down a little bit more on what you said, how we can fix this anomaly with specific recommendations, not just discussions. What would you recommend that FEMA do to change your formula structure? Because right now, it's really discriminating against lower-income communities.
Absolutely. Thank you, sir. I think we see that across several states that have a large urban area population in one portion of the state, such as New York, such as the state of Illinois, where I served as a local and as state director, where the formulas that are used based on the large population in one portion of the state impacts the remainder of the state because of the threshold that needs to be met. So I don't believe that the threshold alone should be the determining factor when making a decision or making a recommendation to the president on a presidential disaster declaration. I truly believe that the localized impact needs to have a significant weight in that process.
Yeah,
so, for example,
I understand. I mean to cut you off. I understand, but what specific changes do we need to do it in the law us as legislators to fix that problem, and not make it an optional thing. Make it say, by law, you must consider these things. What things should we consider?
Well, I think there are things that we can do for rural communities when it comes to areas, for example, Southern Illinois compared to Northern Illinois. Their impact is going to be significant. There is less tax base in those communities. We have to look at not just what the total taxable revenue of the entire state is, but we have to look at the revenues that are in those individual communities. The ability for those communities to recover is significantly lower because of the lower tax base, and because in many states they don't have state programs that can provide assistance in the absence of FEMA assistance. So looking at some of those localized areas, those localized events, what the total taxable revenue for those areas are, what the tax base is in those communities, and being able to provide specific guidance for FEMA to look at that separate from just the large urban areas that make up the overall population of the state is something that should be considered and that we could look at.
Thank you. I'll note that I'm wearing a pink tie today for the very reason you are. So it's a very important cause. Mr. Curry, anything you want to add to that?
I mean, I agree. If we're going to change this problem, we're going to have to do something to the process that the locality goes up through the state, because like Mr. Joseph said, a locality can be, your district completely opposite from Manhattan and lower New York. So something's going to have to be done to change the regulation and how we look at the locality and the specific impact of that. I will say that could be done in law, that, you could require FEMA to do that. A couple of years ago, they did change the factors for the individual assistance program. But FEMA, that's written into regulation. I mean, they could do that without a law as well.
Yeah, but they're clearly not doing that. So sometimes we need to mandate that they do that, because the discrimination and the unfairness continues. And it continues in my district. My district is very different than Mr. Thompson's, but we're experiencing the same problems. And it's just not right, and we got to get it fixed. Thank you, Mr. Chairman. I yield back.
Thank you very much. Chair, Ms. Jackson-Lee. Chair recognizes the gentleman from Rhode Island, Mr. Langevin.
Thank you, Mr. Chairman. And I want to thank you for holding this very important hearing. I want to thank you for your testimony today. I'd like to begin just by focusing my time on the experiences of people with disabilities and older adults, two overlapping populations that are among the most vulnerable in emergency situations, as you can well appreciate. Mr. Curry, if I could start with you, I'd like to ask you about the 2019 GAO report that you referenced in your written testimony. You note that FEMA did not concur with GAO's recommendations to better communicate disaster assistance applicants' disability-related information across FEMA programs. Instead, FEMA argued that it was working on a long-term project to improve data management, which would help make disability data more readily accessible, I should say. So on that point, has FEMA since completed this long-term process? And if so, do you believe it has led to any improvement in its communication of applicants' disability-related information?
Yes, sir. One of our major findings from that report was that when we looked at the enrollment and registration process for individual assistance, we didn't see any granularity in the questions that were asked to really obtain the type of information they would need on disability to help tailor the assistance to the individual that has the disability. And so while they said they were very committed to helping those, the disabled and others, if they didn't have the information, then they weren't going to be able to do anything different that they were just doing for everybody else. So since that time, they have revised the intake process to gather more information. They've also increased the resources at the regional level on their disability coordinator positions there to try to better integrate that into the assistance. So they have made some strides. I still think, like other populations we're talking about now, much more can be done to help tailor the assistance and ensure that people that need it the most are getting it.
Agreed. Thank you for that comment. Continuing on with you, Mr. Curry, if I could, in addition to collecting and communicating the disability status of survivors, response agencies need to be ready long before disasters strike to accommodate disability-related needs. In August, I reintroduced what I called the Ready for Disaster Act, which would establish a network of centers to provide training and technical assistance to state local governments and expand the National Advisory Committee on Individuals with Disabilities and Disasters to better represent the disability community. So, Mr. Curry, do you believe, do you think that these provisions would help address some of the deficiencies GAO identified in its 2019 report?
Yes, sir. I think anything we can do to prepare communities for these types of issues beforehand would be a good thing. These things don't have to be a surprise when a disaster happens. I mean, most communities understand where the folks are with the most disabilities reside. For instance, assisted living facilities and things like that. We know this information. So if we can use it before the disaster and plan accordingly, then anything like that would be very helpful.
Well, precisely my point on the reason for introducing the act. You're spot on. Thank you for that perspective and concurrence. If I could turn to Dr. Peak for it now, I'd also like to hear your perspective on the Ready for Disaster Act. In your testimony, you note that it is social forces that turn natural hazards into human tragedies. So my question is, in your opinion, would better access to technical assistance for disaster relief agencies and more inclusion of people with disabilities in planning from the get-go help reduce the pressure of these social forces?
Thank you for your sponsorship of the READY Act and support for the disability community in our country. And absolutely, to this point about social forces turning natural hazards into disasters, I think one concrete example of that is that people with disabilities are not inherently vulnerable to disaster. Instead, things in our social structure and our built environment may render these populations vulnerable. And so a specific example of that is curb cuts. When we put curb cuts on streets, everybody can have access to the sidewalks. When we don't have those curb cuts, people don't have access. And so I think any policy or program that can advance this kind of equitable vision for groups that are marginalized is absolutely crucial. Thank you.
Thank you. I know my time's expired. Let me just say I think your framework to describe the interaction between natural hazards and social forces really hits the nail on the head. Thank you for your work and your perspective on that. Thank you, Mr. Chairman. I yield back.
Thank you. Gentleman yields back. Chair recognizes the gentleman from Louisiana, Mr. Higgins, for 5 minutes.
Thank you, Mr. Chairman and Ranking Member, for holding this hearing today, and I thank our witnesses for being here. Today's hearing is very important to me because inequity in federal government's disaster response is real, and it has deeply injured my district in Southwest Louisiana. The impact of storms, it can be quite stunning to witness, and yet if that impact is not communicated and does not resonate throughout the federal government and throughout the nation's media, this is when inequity has really suffered. You know, on August 27, 2020, Hurricane Laura made landfall in Southwest Louisiana, and in my 60 years as a Louisiana resident, I have never seen a storm hit that hard and that fast. And just 38 days later, a second Category 4 hurricane made landfall in almost the identical path. Inequity in disaster response, my experience certainly over the last year since Laura and Delta hit, is both political and institutional. And the media is a factor here because, you know, most Americans never realize that Southwest Louisiana experienced mass destruction and homelessness and horrors because it was buried in other news. Louisiana citizens are known for, you know, we rely on our neighbors and our community to recover and respond to hurricanes because, quite frankly, many of us feel that the response from the federal government is not to be trusted and cannot be relied upon. over a year after Hurricane Laura hit Southwest Louisiana, which to note for the Americans watching and our witnesses here today and my colleagues, it's a rural area. You know, a lot of agriculture. It flies under the radar. This is where inequity comes in the federal government's response. Over a year later, there are many Louisiana citizens still displaced, businesses that are smashed, will never reopen, destroyed infrastructure, destroyed homes, and many citizens have lost hope and given up. Thank God our churches and volunteers have performed, because the federal bureaucracies at the executive level has certainly not performed. The executive branch response to a disaster must be noted here as we talk about inequity today. After Hurricane Katrina, the governor of Louisiana requested that the President of the United States request of Congress a supplemental disaster response bill. And within 5 days of Katrina, President Bush responded. But our governor of Louisiana submitted an official request to President Biden and was waiting on his desk his first day in office. That was in January of this year. But you didn't get a response. You didn't get a request from President Biden's executive branch to Congress asking for a supplemental disaster plan, which, as my colleagues know, that's the way things work. That didn't happen until New Orleans got hit. So herein lies inequity. And I'm going to ask Mr. Curry to respond to this, because you stated, sir, you said we need to define inequity. Well, let me just give us a nudge towards reality here. Housing, primary housing, should be our focus as a nation, getting Americans back into some livable housing, their primary house, not their second or third house on the coast, their millionaires, etc. We need our rural folk, our poor folk that are the most vulnerable to loss of housing, primary housing after a storm. We need those citizens back on their feet. We need rural areas to not be ignored by the federal government from the executive level, as opposed to urban areas and cities. And the President of the United States response to a governor of a sovereign state's official request that president request of Congress a supplemental disaster plan. This is where we need to focus our attention and make this thing work. Mr. Curry, does the GAO consider the inequity that I just described to be real? And what would you suggest, sir, as a plan to address it from both legislatively and through executive branch?
Thank you, sir. Well, believe me, those of us that work in this area, I understand the situation in southern Louisiana very well. And I know folks in your district were not just those storms, but still recovering from Hurricane Harvey and also the 2016 flooding in that area too. So it's just unbelievable what they've had to endure there over the last decade. But to answer your question, so this issue of when the president requests a supplemental has been an issue. It was an issue after Hurricane Sandy with the delay, and I know it's come up. Unfortunately, we can't control, or we haven't recommended anything about the timing of when Congress should do that. I do know for most of the big hurricanes you're talking about, there were disasters declared, but there was some delay for some of the later ones.
There's
sir. But
disasters declared. Let me just interject. The declarations, yes,
The
sir.
gentleman
That
from
happens very quickly, but the request to Congress, could
the
you just
gentleman
finish
from
addressing that? And
Louisiana's
I beg that
the gentleman's time has
I
expired.
beg the indulgence of the chairman for the gentleman to answer the question.
Well, if you be quiet, I'm sure he'll answer the question, Mr. Eagle.
Yes, sir. Yes, sir. I'm
All
sorry.
right.
Well, sir, unfortunately, at the GAO, we have made many recommendations about the declaration process, as you said, and they are declared. But we cannot control how quickly Congress moves on a supplemental appropriation.
Thank you, sir. Thank you, Mr. Chairman.
Thank you. Chair recognizes the gentleman from New Jersey for 5 minutes, Mr. Payne.
Thank you, Mr. Chairman. Dr. Peak, Your research has focused on the impact of disasters on children. Can you discuss the unique impacts of disasters on children, specifically on from communities of color? And also, could you recommend to this committee the policies or programmatic changes that should be taken to better address these unique needs?
Thank you, Representative Payne, for asking a question about children. Children make up nearly 1/4 of our population here in the United States, but children remain overlooked in emergency management, in policy, and in practice. And children, they do not vote. They are not in the room when decisions are being made about their lives and their livelihoods, but they are experiencing more and more disasters and coming of age in this ever more turbulent world. And so this is a crucial question, and to what are the impacts on children, and especially children of color in disaster. There is a growing body of research on this, and I'm going to give one specific example from the COVID-19 pandemic, which I think really illustrates the inequalities and also those social forces that turn hazards into massive disasters. So in COVID-19, according to the Centers for Disease Control and Prevention, we know that while children thankfully make up only a tiny fraction of those who have perished in the pandemic, of those children who have perished, they are disproportionately Black, Latino, and from Indigenous communities. And again, that isn't about inherent vulnerabilities. It's about that these children are more likely to live in crowded living conditions, to have parents who are deemed essential workers who are outside the home, and so forth. And so to your question of what are the specific policy actions that we could take around children, after Hurricane Katrina, there was actually a presidential commission that issued a report on children's needs in disasters. There were over 80 recommendations in that report. More than a decade later, most of those policy recommendations have remained unfulfilled. And so I think, Representative Payne, one of the most important things we can do is return to those recommendations that have already been made and to bring them to life, because there is no time to waste. Children of today, again, are experiencing more and more disasters, and they have a role to play in reducing that risk, and we have a role to play in ensuring that their needs are met. Thank you so much.
Well, thank you for that answer. And as you can see, this issue is taking up most of my time, but thank you. It's for those reasons that I introduced the Homeland Security for Children Act, which passed the House unanimously in July. I hope the Senate quickly passes the bill and we can send it to the president's desk. But I want to thank the chairman for his support throughout my time on Homeland Security and my work around children in disasters. The support of the chair has been instrumental in this work moving forward. And with that, I will yield back the balance of my time.
Gentleman yields back. Chair recognizes young lady from Tennessee, Ms. Harshbarger.
Thank you, Chairman Thompson and Ranking Member Katko, and I thank the witnesses for being here today. I do have a couple of questions. The first is for Mr. Curry. I'm looking over some of the stats here, and FEMA obligated $23.8 billion in public assistance funds to Puerto Rico to help with the damages due to hurricanes in 2017 and earthquakes in 19 and 20. And according to the GAO report, they've only spent $4.7 billion of this money. And evidently, the reason was that the Puerto Rican agencies staff were not equipped to develop those projects that they needed to help them recover. I guess, first of all, why is the staff not equipped to develop those plans? And if this is what's happening in Puerto Rico, where else is it happening, basically?
Thank you, ma'am, for the question. The situation in Puerto Rico is a unfortunate case study about a jurisdiction. It could be any jurisdiction throughout the country that has low income population. More than 50% of the population is at or below the poverty level. And what we see in those kind of places is, in general, they lack the staff capacity, resources, and experience that other places around the country that don't have that problem. So think about places like Houston or Florida or California that have the resources and the experience. Part of this is the way these programs work at the federal level, ma'am. So the way the FEMA public assistance process works is it's a reimbursement program, which means it's meant to reimburse the jurisdiction of the state for the costs of the disaster. That works if a jurisdiction has the resources or the ability to obtain capital up front. Puerto Rico doesn't. They're in bankruptcy. They can't get loans. They can't take out bonds, and they have very little wiggle room in their budget. So to provide that upfront funding to start these projects and then get reimbursed is very difficult. And because that's not the way the process has worked typically, that's why. And in fact, ma'am, for permanent work, actually the amount spent on real brick and mortar projects is way less than that. Out of the 23 billion back in June, we found that only, I think, under 200 million had actually been spent. So if you go to Puerto Rico and you're looking for shovels in the ground, you're probably not going to find it.
Well, then if that money has been allocated, is there a sunset for that money to be used, or is that just they use it when they need it or when they can find people to do that?
So yeah, there's no sunset on that money once it's obligated. I mean, eventually disasters can remain open for a long time. Hurricane Katrina is still open. There's still monies being, spent and finalized. So they can stay open for 15 or more years. I mean, you would expect, though, in most disasters to see that drawdown happen a lot faster. For example, take another catastrophic disaster like Harvey or Irma, or you're going to see permanent work projects much further along at this point than you would see it in Puerto Rico. And the main reason for that is state and local resources.
Yeah. Well, that explains that. Then they need a program, I guess, to fix that, to get some things implemented to train these people in one way. I have one other question for Mr. Joseph. FEMA's tried to improve diversity in the workforce through many different mechanisms, but they still continue to struggle to recruit women and minorities in the workforce. And I guess I want you to talk a little bit about what steps FEMA's taking to recruit these people. And the reason I ask is, even in my district in East Tennessee, there was a fire station that needed to hire 10 people, and they recruited from all over the country, and they recruited Hispanics and women and some of the best workers they've ever had, but they would never have done that unless they'd went outside to recruit those and said, no experience necessary, we'll do the training. So if you could expound a little bit about that issue.
Sure. Thank you, ma'am. I cannot speak to what FEMA is doing currently today, as I left several months ago, but I can speak to programs that I attempted to start. Number one, I know that time is running short, but we looked to colleges, community colleges and city colleges when I was at FEMA that were in minority neighborhoods that had a large census of Black and Hispanic students. And I worked with the president of that college to create programs. They didn't have a formal emergency management program, but to look at the vocational programs they had that tied into the things that we do on the public assistance side, or the mission support and human resources side of the house, as well as environmental historic preservation, the areas that we need to focus on, especially after a disaster. I tried to bring them in as interns, but the red tape of the federal hiring process stopped me. I was unable to give those students opportunities in paid internships because of the requirements that were set forth already by OPM on how I can hire interns. So though I identified a president of a college that wanted to sign an agreement with us and wanted to bring their students to me, and I wanted their students to come to me, I need to bring them into the pipeline before I can make them the next director or administrator of an organization. And that's what I wanted to do. So that red tape was difficult, but I think if we can find vocational programs that we can build that pipeline of students from, and then find promotional opportunities. We also created a leadership executive leadership program within the region, made up of diverse employees of the Region 5 office. And we took them through all sorts of things that they wouldn't have learned in their traditional job. We took them out of their comfort zone and created programs. And it was even recognized by the FEMA administrator at the time, who came to Chicago for their final cohort presentation. So there's a number of things that we can do to build a pipeline and within the agency, but we need the help in the hiring process to be able to get them in the door.
Well, sounds like we need to cut some red tape.
Gentlelady's time has expired. Chair recognizes the gentlelady from Texas, Ms. Jackson Lee. Chair recognizes the gentlelady from Michigan, Ms. Slatkin.
Thank you, Mr. Chairman. So I'm from Michigan. The issue that we've been grappling with, particularly this summer, is being hit by severe and repetitive flooding. In June in southeast Michigan, the rains overwhelmed our infrastructure, flooding basements, leaving cars submerged on highways across vulnerable communities. We had our second 500-year flood in 2 years. In August, the Huron River reached its fourth highest recorded level, flooding some of the smallest communities I represent, lake communities in rural areas, Livingston County, for instance, Lake Orion. And then we had another burst of rainfall in Orion Township in Oakland County, what we consider a 1,000-year flood just in the past month and a half. So this is far from normal for us. I went in September and visited Orr Lake in Livingston County and heard directly from the residents there. And I think this is a question for Mr. Curie. They described how they did not have accurate information on the potential for flood, on previous claims that were filed on flooding when they were buying the home. That in fact, under the National Flood Insurance Program, FEMA only shares information about claims on that property when you're the owner of the home, and only when you request it. Buyers can ask sellers to verify a claim if they think about it, but there's no requirement for disclosure. Can you talk to me about, we have Carfax for cars so that you know what kind of used car you're buying and the history it has. Can you talk to me about why it is that a buyer of a home would not be able to understand the history of flooding on a home?
Thank you, ma'am. So on that specific question and what FEMA shares and what the flood insurance companies, the contractors share, I can get a detailed answer back to you on that process. I don't have that on the tip of my tongue. But what I can also tell you about this issue is a major problem with the flood insurance program is that many of those properties that you're talking about were not in the special hazard flood zone. And this is a problem we're seeing around the country. Places are flooding that never flooded. Yeah. Rain events are causing flooding in places where there's never been flooding. And so they're not seen as high risk areas, so they're not quote unquote in the system. And I think that's one big problem. We just issued a report on Monday basically talking about the flood mapping process that FEMA doesn't take into account future conditions as much as it should, because calling these 500 or 1,000-year floods, frankly, it's just not helpful anymore, because these are every year floods, not 500-year floods.
So thank you. And I think certainly with the increased number of storms and the increased ferocity of those storms, we should certainly take up a deep dive look on this here in the committee. We also talked about how disadvantaged many of our rural communities are when they apply. And the overlapping disadvantage that I saw was it seemed like you had to have internet in order to properly engage with FEMA, even if you were in a flood zone. And a lot of our rural communities just do not have access to broadband internet. 1 out of 10 families in one of my counties has no access. So can you talk about how one is supposed to engage with FEMA if they don't have the internet?
Very difficult, because most FEMA enrollments at this point for individuals go through their app or the internet, disasterassistance.gov. The second most cases are through the phone. But as we all know, that's not a fun process. I think the average wait time for the phone is well over an hour. And then the third option is to visit disaster centers in person, which may not be close to somebody's house. And in the COVID environment, I think has become even more difficult. So there's absolutely no question, if you don't have good internet access, applying for disaster assistance would be very painful.
So in my remaining time, if you had just one thing you could do that would have the most outsized impact on helping, in particular, rural communities get better treatment and consideration from FEMA, what would it be?
I think at this point, much more tailored assessment of the localized need, which is what we talked about earlier in this hearing. You know, like for instance, in your state, assessing a very rural community much differently than you're going to assess a suburb in Detroit is necessary if we're ever going to be able to tailor the assistance to these areas any better. Because the way it's done now is it's pretty much lumped all within a state into one package. And as we know, and we've talked about, you know, all areas are not the same.
Thank you, and I yield back.
Thank you. Chair yields back. Chair recognizes Mr. Clyde from Georgia for 5 minutes.
Thank you, Chairman Thompson. We all saw the devastation that Hurricane Katrina had on New Orleans in 2005. It took years for that area to recover.
Excuse me. Yeah, the clock's on. Go ahead. Thank you.
Okay. All right, it took years for that area to recover, and we all learned many valuable lessons in mitigating the effects that disasters can have on communities, especially with issues pertaining to infrastructure resiliency. After Hurricane Katrina, New Orleans made it a priority to work with the Army Corps of Engineers to address issues in their levee systems. The steps taken by the city and the Army Corps of Engineers helped mitigate the damage of Hurricane Ida when it made landfall at the end of August of this year. And I am pleased to have 3 companies in my district that helped to strengthen the levee system of New Orleans. Tenkata Geosynthetics, located in Pendergrass, Georgia, produced several high-strength polyester products to reinforce the levee. Patterson Pumps, located in Stevens County, Georgia, manufactured the pumps for the levees. And ABB Motors, located in South Hall County, Georgia, produced the motors that powered the Patterson pumps, electric motors that are designed to work when completely submerged underwater. And I am proud of the work of these companies, what they did to help preserve New Orleans after Hurricane Ida. And I hope that we can continue to learn from these disasters and strengthen our capability to eliminate the vulnerabilities in our nation's infrastructure. And I'm sure that Tenkata, ABB, and Patterson will continue to play a valuable role in that mission. And now I have a question for Director Chris Curry. Sir, I know firsthand the many risks that come with owning a small business. As a small business owner for over 30 years, I have had to plan for every possible scenario in order to just keep my doors open. And I also understand the great value small businesses provide in helping a community recover from a disaster. Director Curry, in your testimony, you highlight that for every additional dollar spent on disaster loans per establishment in a county, 4 small businesses survived in the wake of extreme events. Can you talk a little bit more about GAO's preliminary finding that select federal programs may contribute to the survival of small business establishments, sir?
Yes, sir. I mean, you hit the nail on the head. I mean, the whole purpose of these programs, and particularly, I think you're referring to the Small Business Administration Disaster Loan Program, is to ensure that no business goes underwater because of a disaster or because of the loss of revenue of a disaster. And so it's a cascading domino effect. If businesses go underwater, then individuals lose employment, and it's just dominoes from there in the community. So absolutely, they have a huge benefit. Now, the concerns that we've had recently in our work is one, is everybody getting access to these? And is everybody applying that could get access to them? One of the things we see in these programs is that they're very, very complicated, and there could be built-in disincentives to applying for these programs. For example, some people that want assistance may not want to get a loan. They don't want to apply for a loan. They just want grant assistance, and so they may not apply. So I think these are some of the complexities that we have to look at.
Well, thank you, because we know that small businesses are definitely the backbone of America. And when small businesses have problems, then America has problems. Now, as a follow-up question to that, does your report examine how the survival of those small businesses impact the community's efforts in rebuilding?
Sir, it doesn't dive into that or quantify that, but it is well accepted that the businesses in the community are critical, not just for employment, but for the tax revenue of a community. If businesses go under, then they lose tax revenue and they lose the locality and the jurisdiction's ability to be resilient and prepare and respond to events. So it's really a domino effect.
Thank you very much. I appreciate that information. And with that, I yield back. Chairman Thompson.
Chair recognizes the gentlelady from Texas for 5 minutes.
Mr. Chairman, thank you so very much for your kindness and, of course, for the timeliness of this important hearing. And to the ranking member, I have enjoyed my time on this committee, not because we have faced disasters and terroristic acts, but because we have the greatest opportunity to help people in their desperate time of need. Let me thank all of the witnesses. I think I have been, since coming to the United States Congress, in every storm on the Gulf Coast and beyond. Been to Puerto Rico, the U.S. Virgin Islands, was on the ground at Hurricane Katrina, stayed in the Astrodome, not the Astrodome, the Superdome, different locations, but I've been in the Astrodome when the Hurricane Katrina survivors came from that storm-ridden city, helped them be comforted and to do what we could as Houstonians, and thank everyone for all of their support for us during Hurricane Ike and Rita and Hurricane Harvey, which devastated my congressional district. So this issue of equity is crucial. I still meet constituents with blue tarps on their roofs, and the devastation of Hurricane Ida is still painful. Let me quickly ask the question about the reform of FEMA, which I think is one of the greatest agencies. But I have introduced in the past Congress HR 3060, which I intend to work with the chairman and the chairman of the subcommittee on this issue again. Let me share with you some of the aspects of it and have like your comments. It makes permanent the FEMA Office of Disaster Response and the FEMA Office of Disaster Recovery, creates an ombudsman for each office to assist survivors and victims which feel left behind, even with the great work of those FEMA persons on the ground, establishes a new national disaster medical triage capacity and incident medical recovery management team to determine best practices for implementing advanced trauma life support capabilities affecting medical evaluations, establishes a program to provide education and job training, focuses on these CERT teams, establishes and creates an Office of Ombudsman to work within the agency to create equity and access, what we're talking about here, provides for accurate reporting on deaths and missing persons, which we fought for during Hurricane Katrina to get the number of deaths. And initially, we couldn't get anything, collect data and reports on effective casework management so that people are followed all the way through, help homeowners who in the past were left out of the full benefit of federal government disaster, partly because of the home ownership connection that they would ask for. So hoping FEMA get its hands around how to deal with disasters, I think is crucial in the equity question. So I would appreciate Dr. Peak, Dr. Willis, Ms. Willis, and our GAO commenting. Anyone else can as well. But Dr. Peak, can you comment on the framework of helping to reform FEMA? Thank you. And my time is short. Dr. Peak?
Thank you. Can you hear me, Representative Jackson Lee? Okay,
yes.
Thank you. So first, just acknowledging the number of disasters that have hit the people in your district, and your leadership to bring survivors to the table is absolutely critical. We know that oftentimes, even when our aid providers have the best of intent, if we don't have the voices of survivors at the table, this is when things can go badly awry. And so I think your idea to integrate survivors into the work that's happening and to ensure that they have a voice in all that is happening is absolutely vital. And in the interest of time, I'm going to turn this over to Ms. Willis right now. Thank you.
Thank you very much. Ms. Willis?
Yes, thank you so much.
And then Mr. Curry? Yes, thank you,
Yes.
Ms. Willis.
Thank you. I think that's a great point. I think anyone could support the reform of FEMA based on the tenets that you've provided. I think it's very important, as Dr. Lurie said, that we acknowledge the voices of the people that have been ignored for so long. Right now, there's a disconnect. Our organization deploys equity response teams to disaster locations so that we can ground truth and hear from disaster survivors. That is something that I believe would be very beneficial for FEMA to also employ. And also, I think it's important that we understand that many of the policies that FEMA operates with are inequitable and must be revised. They were not created with equity, and so the outcome is inequitable. And it's just that easy to really reframe and understand. Once we change the policies, we'll see better outcomes. And right now, the policies have to be changed. I yield.
Thank you.
Thank you.
GAO, sir?
Yes, ma'am. I think all of those ideas sound like good things to do. I agree with Ms. Willis. I think, this lens of equity is new in terms of not the problem, but this lens of looking at all the programs through equity is new. And so it's going to take a top-down approach by FEMA in all of their programs, not just little things here and there. They're going to have to look from top to bottom at these programs and find every place, from their policies, their strategies, all the way down to mechanical issues like how are questions asked in the enrollment to address some of these issues. And I know that they get that, and it's taking some time, but it's not going to be easy, and it's going to take them a while to figure this out. And so they need to do that, and then we need to come up with a way to measure that we did what we wanted to do. That's the other difficult piece.
Thank you so very much, Mr. Chairman, for the time. Thank the witnesses for their very astute testimony today. Thank you again to my colleagues.
Chair recognizes the gentleman from Mississippi, Mr. Guest, for 5 minutes.
Thank you, Mr. Chairman. Ms. Willis, in your written testimony on page 1, there at the bottom, you say the declaration process under the Stafford Acts limits the assistance to individuals, families, and communities in need, with major disaster declarations lying in the hands of partisan politics and state-administered funding support. And then you list our home state of Mississippi as an example. And just ask, if you would, could you please expand upon when you're talking about the fact that this, the role that partisan politics plays in disaster relief and the interplay that you see between those two?
Absolutely. I think that's a fantastic question. I think that we must understand and address the politics that comes into play after a disaster. Disasters are about people and should not be about politics. When people are suffering and going through the worst times of their lives, it is not the time to decide whether or not you're going to help them based on their political affiliation. And unfortunately, that is what we have seen and what we continue to see in disasters. Many today have already described that their location, their jurisdictions were denied assistance for presidential declarations, and they felt that it was probably partisan. And this is something that occurs, and we must address the humanity of disaster. We must address the fact that in places like Riverdale, Mississippi, where the government decided to not pursue disaster funding for those who were most impacted by flooding events, we must address that and understand that there are impoverished communities that do not have a voice. And when the local emergency managers and the governors or government of the state do not acknowledge the needs of those who are most vulnerable and do not have a platform to receive and request assistance, there is a larger divide and gap in equity that is created. And also, their needs and ability to recover in a timely manner is impeded. Thank you.
And let me ask you specifically, because you cited here in your written testimony that following Hurricane Ida, that counties, and you include Wilkinson County, Pike County, and Emmett County, that they suffered significantly. And again, you seem to cite that there was partisan politics that played into either the delay or the lack of disaster relief for those three counties. And particularly, could you share with me whether that was partisan politics on a state level, was that local level? Where was the disconnect? Where was the partisan politics as it relates specifically to the three counties that you list there in your example, so that we can help address that in our home state of Mississippi?
Yes, and that's an excellent question. And as I mentioned before, our family is from Mississippi, and so we have a very personal connection to the people and their experience. And one thing that we need to be clear on is that many times vulnerable communities are not receiving the amount of preparedness or mitigation funding that they are due. And post-disaster, the resources that come into those communities can be impeded by the decisions of local government agencies. And that is something that has been proven, and that is something that must be addressed. And I believe that by modifying the Stafford Act and the process for making declarations and the process for requiring those very distressed residents to take pictures, to fill out complex applications is at the heart inequitable. And that must be something that we consider as we make modifications to these policies to make them more equitable. Without that equity, we will continue to see disproportionate impact and delayed recovery. And so those areas that we mentioned definitely must receive more outreach and equitable assistance.
Well, specifically as it relates to those three counties, because those are three counties that I serve in the 3rd Congressional District, is it the partisan politics? Is that local? Is that something that I need to address with local leaders? If that partisan politics on the state level, is that something I need to be addressing with MEMA? So I'm just trying to get specifically as it relates to those three counties that you listed in your example, where that partisan politics lies so that I can have the opportunity to try to address that. And so, again, as it relates to those counties, what level do you see where the partisan politics is affecting disaster relief to those citizens?
I would suggest that we look at all levels. I think ongoing issues such as denial of funding, denial of recovery assistance, and the fact that many of those counties were not able to receive assistance even post Ida and during the storm in June. We need to look at why they have been denied funding, and those are ongoing issues that must be addressed at every level. It's not just the county, it's not just the state. We need to look at how the counties, the local level is coordinating with the state and the federal government as well. All levels, sir.
Thank you, Mr. Chairman. My time's up. I yield back.
Thank you very much. Chair recognizes the gentleman from Texas, Mr. Green, for 5 minutes.
Thank you very much, Mr. Chairman. I greatly appreciate the opportunity to pose a few questions. And I also would like to thank the staff for the excellent intelligence provided so that I may be able to pose the question. Mr. Chairman, I've spent most of my adult life fighting invidious discrimination, not because I wanted to or chosen this as my mission in life. It's because I have found myself in positions where I've had an opportunity to make a difference, and I've tried to do so. Today is a continuation of this effort. I want to talk about racial disparities. In zip codes with more Black Americans compared to predominantly white areas, Black neighborhoods had a lower rate of securing an inspection, higher likelihood of disaster assistance being denied without an explanation, and less assistance when awarded. A 2019 study found that FEMA grants were less likely to be awarded to survivors who lived in communities with more racial minorities, contributing to almost a 40% increase in bankruptcy rates in these areas. So, Director Curry, Has FEMA studied the disparate impacts of race on its programming?
No, sir, not comprehensively. And this is one of the problems we've identified in our work. FEMA has not traditionally captured demographic information across all of its programs. And their position in the past was that they were not able to do that because of certain statutes. However, I think that approach and that view is changing under this lens of looking at programs under equity and needing that data and that information to better assess the impact of its programs and where they're going. So one of our findings is that, we just need better data and quality information first to better assess these types of things and figure out what the challenges are.
Well, one of the challenges is always acknowledging what the problem is. Have you found an acknowledgement of structural racism in programming?
I think that FEMA and other agencies acknowledge, and we saw this in the president's executive order he issued in January, that these programs have not benefited underserved communities as much as others, and underserved communities have faced obstacles in getting the assistance as well.
Dr. Peak, what does the research say about why these impacts exist?
Yes, first, Representative Green, thank you for your leadership in this area. And I just wanted to your prior question to say some of the various staffers and leaders at FEMA who I've worked with and fellow social scientists have worked with, they are very aware of these recent national level analyses that have revealed these racial inequities, and I think are taking this very seriously. But as Mr. Curry has emphasized time and time again, this is going to be a long and challenging process that is really going to take more data, more research partnerships, and so forth to further uncover those mechanisms that are driving these inequalities that you're rightfully bringing to light. And so what is driving this? The first thing I'd say, there's no single answer. As with any, as you well know, as with any complex social problem that is rooted in our history and our social structures, we can't just point to one thing and wave a magic wand and fix these deeply rooted issues. And so that's why I think FEMA putting forward the definition of equity, forming the equity councils, working together with researchers and community-based groups who this is their expertise, and bringing that into the agency with experts in the agency. I think these are all crucial first steps, but they are just first steps that are so important that we take, but we have a long road to travel if we're really going to get to this equitable outcome where the people who need the aid the most receive the aid. Thank you.
Well, I thank you, and I have less than 20 seconds left, so I won't follow up with another question. I will simply say this. It really is time for all government agencies to take a hard look at what's happening, because these issues hurt people, many of whom don't have lobbyists to help them. They need the assistance that's being provided, and my hope is that all of these agencies, especially FEMA now, will take a hard look at what's happening. And I thank you for being here today. Thank you, Mr. Chairman. I yield back.
Chairman yields back. Chair recognizes the young lady from Iowa, Ms. Miller Meeks, for 5 minutes.
Thank you, Mr. Chair. And this is for Mr. Curry. Mr. Curry, as you know, Iowa is in floodplains both between the Mississippi and the Missouri River, the Des Moines River. And the National Flood Insurance Program, which is administered by FEMA, offers insurance policies for homeowners in areas that are prone to flooding. The NFIP has been largely criticized because communities of color and lower income areas are disproportionately less likely to be covered. Earlier this week, the GAO published a report on the NFIP. Based on the report, how can NFIP be improved?
Well, thank you, ma'am. The issue with the National Flood Insurance Program, there are so many issues to discuss. It's one of the reasons that NFIP has been on GAO's high risk list since a federal program since 2006. And so, I won't get into the issues with the sustainability and the solvency of the program, but as you probably know better than anyone in Iowa, the program is not fiscally solvent. It doesn't take in enough revenue to cover its costs. The premiums and the costs do not reflect actual risk. So there are a number of structural challenges with the program that Congress has worked over the years to try to address. But let me talk about the most recent report we did, and specifically, because what we looked at is the flood maps. And those are extremely critical to this whole process, because what those do is they set up the special hazard flood areas by which FEMA uses to determine who is in those and out, and who has to pay for flood insurance and who doesn't, and then what their premiums are. One challenge that has happened is that the special hazard flood area over the years is not reflective of actual risk. Many areas outside of the special flood hazard area now throughout this country flood and cause tremendous amounts of damage. And so the perfect example of that is what happened in West Virginia a few years ago. That was not a special hazard flood area. Those were not on any FEMA flood maps. And so people are flooded, and oftentimes they don't have insurance that'll cover flood. So, one of the things we found is FEMA needs to do a way better job of encountering, future conditions into these flood maps if we're going to have an actual picture of risk to decide where to help people for flooding and what to do in that regard. We also found that FEMA does not target flood mapping resources towards the most vulnerable areas, which has been a problem over the years as well. So, we don't have good information about flood risk in the most vulnerable areas of the country.
Thank you. And do you think that FEMA's risk rating of 2.0 better enables lower income communities to participate in the program, or is it a hurdle?
So I think risk rating 2.0 does a better job because they're trying to get more granular data, so they actually have a good picture of flood risk for that property, a specific property. But this gets into this bigger challenge we've been talking about today. These programs are incredibly complicated. And very technical. And so what does that require? That requires state and local governments to have the resources, the local capacity, and the resources to bring on technical experts and consultants. So who's going to have those resources? It's going to be higher income areas and higher income jurisdictions and counties. And so this is just another example of where extremely complicated processes and programs fall harder on more vulnerable jurisdictions because they don't have the same level of capacity and resources.
In the report, it also examined equity challenges at FEMA, HUD, and SBA, and the GAO studied these specific agencies because they all manage federal recovery programs with historically large amounts of disaster-specific obligations. Why is it so important for the to disaster recovery that these agencies work together?
Thank you for asking that question, because I know some of those agencies fall out of the committee's jurisdiction, but for a state or local government agency, it's all federal funding. Even though it's coming from different federal departments, it's just billions of federal dollars coming into play. They all have different rules, requirements, timeframes. And so what we don't want to see is we don't want to see problems fixed in this area in one program and then the other 8 programs that not be fixed, because that's not going to help people at the local level. It's just going to be more complicated. So if we're going to do this, we need to do it right, and we need to look from the top down at all the major disaster recovery programs. And those agencies manage it's hundreds of billions of dollars over the last few years in recovery funding.
So it sounds like the intelligence silos that we had to break down after 9/11, we need to break down some of those silos that are existing in our federal disaster recovery programs.
It is very true. It is very true, and it's very difficult because it crosses aid departments. They don't have to work together. They don't have to share data, and it crosses committees of jurisdiction in Congress as well.
Thank you so much for that, and thank you, Chairman Thompson. I appreciate the ability to question the witnesses and for their testimony.
Thank you very much. Chair recognizes the gentlelady from New York, Ms. Clark, for 5 minutes.
I thank you, Mr. Chairman, and I thank our ranking member, Katko, for holding this important hearing on our nation's disaster response framework. Let me also thank our witnesses for your testimony here today.
When disaster strikes, the most vulnerable and underserved communities among us bear the greatest impact, and we've been hearing that all morning. Once recovery efforts begin, the very same communities who were most impacted also receive the least amount of assistance. We saw this with Hurricane Katrina in 2005. We saw it in my home city of Brooklyn, New York, 9 years ago with Superstorm Sandy, and we continue to see it right now with the remnants of Hurricane Ida that caused widespread flooding and devastation across New York, New Jersey, Pennsylvania, and Connecticut. Equity needs to be front and center in how we approach this issue and plan for the future. So I'm very glad that we are having this conversation today. But let's be very clear. Equity does not mean treating everybody the same. To the contrary, it means targeting resources and outreach to prioritize those with the greatest needs and vulnerabilities. We need to do this before disaster strikes, when disaster strikes, and after disaster strikes. Only then will our emergency management system be truly equitable and just. In FEMA's National Advisory Council's 2020 report, the council notes that, quote, first responders do not rescue people who can evacuate themselves. They only rescue people who need help. Recovery programs, however, seem to do just that. They provide an additional boost to wealthy homeowners and others with less need, while lower income individuals sink further into poverty after disasters, end quote. FEMA's assistance programs inherently favor wealthier white communities, and this is true of both homeowners and renters alike. We saw this play out in Brooklyn after Superstorm Sandy, where low-income families and people of color were disproportionately dislocated from their homes and communities, many permanently. So, Mr. Curry, to what extent does FEMA take into consideration the needs of low-income renters in disaster recovery?
Ma'am, thank you for the question. So the income level of a jurisdiction is supposed to be part of, and one of the factors that's considered when FEMA is working with the jurisdiction and the state to decide whether it reaches the level of needing federal assistance. So it's built into the process and it's mentioned. I think the question is how much information, how much distinction is being made between vulnerable populations and low income districts versus others. And it's, as I mentioned earlier, I think there's not really any strict criteria for doing that, and it's somewhat vague, which I think makes it difficult to really target the assistance in a way that's probably necessary. Because you made a great point about equality versus equity. I mean, I think the posture in the past has been that we're going to implement these programs the very same for everybody in every jurisdiction. And over time, what that's created is, as we know, not everyone has the same level of capacity and resources. So it's going to affect people differently. And that's what's happened over time.
So as we look to create an equitable recovery system, how can we ensure that assistance programs are better targeted towards and designed to support underserved communities, particularly in areas with large numbers of renters and where folks live predominantly in multi-unit dwellings?
Well, I think the first thing we need to do is figure out where those areas are. And we already know it wouldn't take that much work for a state or a jurisdiction to identify their most vulnerable communities and come up with the criteria for why they're vulnerable. And then we need to look at these programs and figure out how they need to be tailored to better address those communities.
So let me shift gears very quickly here. My FEMA Climate Change Preparedness Act would create a subcommittee within FEMA's National Advisory Committee dedicated to helping the agency incorporate the risks and impacts of human-caused climate change. As I was reviewing the National Advisory Council's 2020 report, I noticed that they had a similar recommendation around equity. The report recommends the establishment of a federal advisory committee focused specifically on how to best measure equity and incorporate an equity standard into the agency's preparedness, mitigation, and recovery efforts. So my question is, do you agree with the report's recommendation that an advisory committee would be a useful tool in helping FEMA incorporate an equity-based approach into the agency's programs and policies? And if yes or no, could you tell us why?
Yes, ma'am. I think an advisory committee would be a great idea to ensure they're consulting with the right people when they do this. But I also think, and one of our findings is that the key recovery agencies, FEMA, HUD, SBA, and others, they need to directly work together to take this issue on too.
Very well. Dr. Peak or Ms. Willis, your comments on an advisory committee?
Yes, I would agree that that is critical. I think that trained equity strategists could really benefit FEMA in developing policies and also understanding how to properly communicate with those that are disadvantaged and that have been historically excluded and marginalized by their policies. Many of their policies are complex, and complexity is in itself inequitable.
And Mr. Joseph?
Thank you. I would agree that advisory committees are important, but as Mr. Curry mentioned, it takes the agencies to come together to actually put that into action. The advisory committee will make recommendations, but unless there is a requirement or a deadline to take action by a certain time or a certain date, it's not going to happen. My kids have meetings all the time about what to have for dinner, but it's mom and I that do the cooking. So it is important that while there's recommendations, there still has to be action taken at the agencies responsible for carrying that out.
Thank you, Mr. Chairman. I yield back. Didn't realize I was over time. Thank you very much for your testimony here
Thank
today.
you very much. Chair recognizes the young lady from New Jersey, Ms. Watson Coleman.
Thank you, Mr. Chairman. Thank you for this hearing. Mr. Joseph, I want to ask you a question. Could you tell me specifically what are some of the requirements and the red tape that exists that interferes with getting minority students on as interns and hiring from the colleges into the federal government? Could you speak to them?
Yes, ma'am. Thank you. And I don't want to say that there's red tape that prevents a minority from being hired in federal government.
Well, just tell me what makes it so confusing.
Absolutely. What was very difficult, number one, the process by which someone has to apply for an internship or apply for a job is confusing and difficult to many that have never accessed. I'm sorry?
Like what? Like what? I'm trying to get some specifics here. Like
Sure.
what?
There's very specific requirements on how resumes are, the types of documents that you may need to submit, the types of forms that may need to be completed. They're not always the same in every job posting or job hiring. There is most often, even for internship programs, an absolute veteran's preference. So if there's an individual that was not a veteran, I'm not saying that we should remove any veteran's preference, but those are hindrances. There is a competitive process that needs to apply to different positions that has been part of the red tape.
Thank you. Mr. Joseph, through the chairman, may I ask that you kind of send me a list of those things that we need to look at?
I will.
That
Absolutely.
you feel represent some impediment. I'd like you to look at that. Thank you.
Yes, ma'am.
For Mr. Curry and Ms. Peak, could you tell me what flexibility FEMA has and what could FEMA do in Puerto Rico, since only a third of the money allocated for its disaster recovery has actually been spent, and because Puerto Rico is in the financial straits that it is in? Does FEMA have flexibility in being able to help Puerto Rico in this situation? And B, what would that be? And can I have that kind of quickly, because I've got one more other question I really want to sneak in here.
Thank you, ma'am. I'll try to answer it quick. So my understanding is that FEMA does not have a lot of flexibility with the funding, the way the program is structured, because public assistance is a reimbursement program, which requires the money to come later after it's started. What we've told FEMA to do is work with Puerto Rico hand in hand, which they've done since the beginning, since Hurricane Maria, on a strategy to help them identify priorities for funding within their own budget and how to secure additional funding to start some of these projects so that reimbursement process can start. That's what we've recommended that FEMA do.
Yeah, well, if you don't have any money and you can't get any loans, so how is FEMA addressing that? That sounds like a catch-22 situation here.
Yeah, absolutely. Well, there is some flexibility in how much funding Puerto Rico can provide to start the projects, and then FEMA can start reimbursing them right away. I mean, traditionally, they would wait until the project was done or big pieces of it were done. There is flexibility in how, and they are looking at that too, because they realize Puerto Rico's in a special financial situation.
Well,
So
beyond looking at it, are they doing anything? to improve the
Well,
situation? Is it moving any faster?
They are trying to move faster and dedicated a lot of resources towards reimbursing Puerto Rico to do that. And so, we're going to continue to look at that and stay on them about the process and how quickly they're actually spending this money in the years to come.
So a question for each of you really quickly, and it's yes or no. Is FEMA currently configured, organized, prioritized in a way that is responsive to the objectives of this discussion that we're having today, or is there a need for a massive reorganization? We'll start with Mr. Curry, then Mr. Joseph, then Ms. Peak, and then Ms. Willis.
Well, what we've seen is that I know reorganization is often something that people turn to as a quick action because it's very tangible and specific. I don't know that it's so much a reorganization or moving the deck chairs in FEMA, but I think it's a kind of a top to bottom cultural change. And I think as the new administrator, Deanne Criswell has come in, I think she has set that tone. But you have to start at the top and move your way down through the programs culturally.
Thank you. I appreciate that. I think that's where I'm trying to head to. Yeah. Mr. Joseph and Ms. Willis and Ms. Peak, do you agree with that?
Ma'am, I would agree with Mr. Curry that it doesn't need an overall reorganization, but a reorganization of thought and greater advocacy. That's already occurred through the Office of Equal Rights in FEMA, as well as Administrator Criswell. I'm not speaking for FEMA now, but appointing a senior advisor of the Senior Executive Service to be her advisor on equity and inclusion. So there's things that are happening which are great.
May I hear from you, Ms. Willis?
Yes, I would agree that FEMA needs to be reorganized to prioritize equity and to prepare for the ongoing and upcoming climate change crisis, which will impact more people, particularly those who are disadvantaged. It is not structured right now to address equity in all areas, regardless of advisement to the administrator.
Yeah, thank you. And Mr. Chairman, I've heard a lot of things that I think need some legislative response, particularly as it relates to sharing information, collecting information, and doing the kind of value calculus that gets to the people with the greatest needs. I look forward to working with you on that and with our ranking member. Thank you so much. I yield back.
Gentlelady yields back. Chair recognizes the gentlelady from New York, Ms. Rice, for 5 minutes.
Thank you so much, Mr. Chairman. In 2018, years after Hurricane Sandy devastated Long Island and the Northeast, my constituents learned that local officials conducting property damage assessments failed to notify many homeowners that their homes had experienced substantial long-term damage during the storm. Many of those homeowners only learned the true extent of the storm's devastation when they tried to sell their homes, and at that time discovered mold, foundation damage, or other issues that made their homes unsellable. Now, I know that these experiences are not unique, and individuals all over the United States can speak to the uneven administration of federal relief following natural disasters, whether due to poor state, local, and federal coordination, understaffing, or even a lack of political will. The elderly and people of color do not benefit from federal disaster relief compared to other Americans. Now, the Stafford Act assumes that the federal government, states, and localities will work seamlessly together to deliver the right amount of relief to the right people after a natural disaster. But we know this does not happen in practice. So this has been a common theme throughout this hearing. And I would just ask Dr. Peak and Ms. Willis, where does the system most often fall short? Is it at the local, state, or federal level? How can we create or encourage a more holistic approach to disaster relief that improves intergovernmental coordination? And I don't know, can the federal government support workforce development and build capacity and expertise at the state and local levels? Because when these disasters happen, people turn most immediately to their local authorities. But then FEMA comes in and it's just a mishmash of applications they have to fill and duplication of benefits. It's just such a mess, and it's impossible for people to actually navigate these very treacherous waters. So just, to you, how can we make this system more responsive so that we don't have local officials pointing to FEMA and FEMA pointing to local officials, and the big loser is the homeowner in the middle?
Chauncey, would you like to lead off, or would you like me to? Okay, so first, thank you, Representative Rice, for that the question, and I really want to acknowledge colleagues at New York University, Columbia University, and Rutgers University who've been leading a Sandy Child and Family Health study that's been looking at the mental health impacts on people in your district and beyond in terms of these protracted recovery processes. And these are some serious findings about how that second disaster that follows the first can have such a profound impact on people's lives and ultimately their livelihoods. So really want to acknowledge that first. And then I'd like to pick up on your second point about this opportunity for workforce development. There is a team of sociologists who've been conducting long-term studies in Alaska following the Exxon Valdez oil spill. And one of the most innovative things that they did, I believe, in addition to their extraordinary research, is that as they recognized the long-term mental health and physical health impacts of that disaster, they started to establish a series of survivor councils. And they said, who's better positioned to not just counsel and advocate for fellow survivors, but also to help articulate the needs at the local, state, and federal level. And those survivor councils have made such a profound difference in empowering those who have lived through the trauma of disaster and helping to move the needle on this issue that we're talking about today. So I really hope that you'll follow up on that, and I will turn this over to Ms. Willis now. Thank you.
Thank you for that. I think, is Ms. Wills unmuted?
Ms. Willis, unmute yourself.
Yes, I'm here now. It was having some difficulty unmuting, but thank you so much for that question. And I really think the answer to establishing better coordination and collaboration at the local and state level really relies on understanding the communities. I've been an emergency manager for over 20 years, and I can tell you that many emergency managers do not do community assessments or really understand all aspects and all communities located within their jurisdiction. In addition, there is a disconnect with understanding the under-resourced and why those who are more vulnerable are under-resourced. And so there's a disconnect there. I also want to mention that I recently returned from Louisiana and working with the Pointe-au-Chien tribal nations and other groups that have been disenfranchised and have experienced many disasters where they have not received consideration by the local jurisdiction, nor the state. And so, as we discussed earlier, this exclusion is something that must be accounted for by FEMA and the other federal organizations when considering who receives mitigation funding and infrastructure support. Many communities are just not provided with a platform for recovery, and now a significant amount of funding is going to more established communities and not into those vulnerable communities that really need assistance prior to a disaster.
Thank you to the witnesses, and thank you, Mr. Chairman.
Thank you very much. Chair recognizes the gentlelady from California, Ms. Barragan, for 5 minutes.
Thank you, Mr. Chairman. FEMA regulations state unhoused individuals may access very specific forms of support. Advocates have voiced concerns that FEMA does not provide sufficient assistance for unhoused individuals. Ms. Willis, could you describe the extent to which FEMA takes into account the needs of individuals experiencing homelessness before a disaster?
That's an excellent question, Representative. I'm not sure if I'm the one that really needs to answer that because I've never worked directly with FEMA. However, I can tell you the perspective of the communities and those that have experience working with FEMA would say that they have not been provided with a full recognition. And in some cases, working with Hurricane Harvey survivors, our team partners, West Coast Recovery, has actually seen survivors report that they felt like they were expendable. They felt like their skin and their lack of education and their income level made them less of a priority to the federal government. And in fact, housing inspectors in some cases, did not even cross the threshold into some houses, those that were, impacted by disaster and had housing damage. The inspectors never even came in certain communities. They just assumed that because they were impoverished or African American communities, that the damage was pre-existing. And so when you're dealing with inspectors that haven't been trained to be culturally respectful or practice and prioritize equity, we see these outcomes where entire groups, entire neighborhoods, entire communities are disenfranchised and their recovery is delayed and impeded, and other communities are prioritized and allowed to rebuild in a timely fashion.
Well, thank you, Ms. Willis. That's very disturbing to hear, but this is why we're doing this hearing, to get the testimony and hear what's happening, how we can fix it. Mr. Curry, what actions could FEMA take to improve programming for unhoused individuals?
So in regard to the homeless, I think one challenge here that's been talked about already today is that a lot of these programs are designed around property owners or people that can prove their link to property. So they have a deed to the property, they can establish home ownership, they own a car. Owning property is a big indicator of who's likely to get assistance. So obviously for the homeless, that's going to be a huge challenge. And so a lot of these programs are not directed towards the needs of people that don't own property.
Got it. Thank you. Mr. Curry, this next question is for you as well. FEMA's regulations and guidance for individual assistance do not include specific monetary thresholds nor specific damage requirements, but instead there are a number of different considerations that FEMA is supposed to take into account when recommending the authorization of individual assistance. However, anecdotal evidence points to the contrary. Mr. Curry, from your perspective, does the present system result in fewer individual assistance awards to low-income and rural communities with lower property values?
So two things on this, ma'am. Great question. First of all, I think one of the things we found is that FEMA doesn't have the data to really be able to say whether that's the case or not, and that's the problem. They need to go back and they need to look at this information, looking at the factors versus areas that were declared and assistance that was provided, and make an assessment of what the case has been across the country historically over the last few years. But I will say this, that while these factors, such as vulnerable populations, low-income communities, unemployment, lack of insurance is another huge thing. Those are supposed to be factored in when a declaration recommendation is made to the president. These factors are very, very vague, and it's not quantitative. And so, what could happen in rural Mississippi could be completely different than what happens in another part of the country. And I think this has been a major source of frustration by local officials over the years. They might even see a neighboring county in another state be declared for the same disaster, and they weren't. And they don't know why, and they weren't given any rationale.
Well, thank you, Mr. Curry. I don't have a lot of time left, but I would be interested in following up with each of you afterward about my next issue, and that is, the Biden administration launches Justice 40 initiative, which will prioritize its work on climate change and directs 40% of federal climate benefits to go to the disadvantaged communities. And then following the announcement of this, we've seen FEMA award grants to its programs like Building Resilient Infrastructure in Communities, the Hazard Mitigation Grant Program, and the Flood Mitigation Assistance. Maybe in follow-up in writing, you all can let me know about what more FEMA can do to help disadvantaged communities win climate grants. Climate is definitely a big topic. We have Glasgow coming up next week. We'll look forward to seeing your responses in writing. Mr. Chairman, I'm out of time. I yield back. Thank you.
Thank you very much. Young lady yields back. We've gone through all our members, but I have a question that I'd like to frame for all the witnesses. And it talks about the Red Cross's role in mass care responsibilities. In the state of Mississippi, there are 32 full-time Red Cross employees. I represent the capital city. I have the largest land area in the state, but there's not one full-time Red Cross employee in my entire district. So the inequities start off physically with just nobody there. So the Red Cross, often staff and volunteers, are not representatives of the communities they serve. How important is cultural competency in disaster response? How does it affect disaster response when emergency personnel don't reflect the communities they are serving? And some of us have talked about Katrina. I remember the Katrina experience because the Red Cross at that point even refused to go into certain low-income communities, and it became quite an issue. But here we are, the Red Cross of today is not representative of the constituencies that are adversely impacted the most in disasters. So just as your own opinion, we'll start with Dr. Peak, Ms. Willis, Mr. Curry, and Mr. Joseph.
Thank you for bringing this issue of cultural competence into the conversation, Chairman. It is absolutely critical. Absolutely critical. And my understanding is that FEMA has actually made a commitment to engage in cultural competence training for all of their employees. Again, this is an important first step, but then it's crucial that we measure what a difference a training like that might make. We actually have developed a training module for disaster researchers and practitioners that focuses specifically on cultural competence. And a final point that I want to make about this is actually related to an extraordinary organization called the Bill Anderson Fund, which is dedicated to ensuring that the disaster professionals and researchers of the next generation are reflective of the communities that we are studying and serving. And so they are training, mentoring, empowering, and bringing to the table Black and Latinx and Indigenous students as a next generation workforce and leadership in this space. And so I think this is a really important forward step in our community. Thank you.
Ms. Willis.
Thank you. Cultural competence is important. And as you have mentioned, Chairman, that is disturbing that so many from the Red Cross have not been provided. There hasn't been any representation within your district from the Red Cross. When I think about the historic bias that is interwoven within volunteer agencies, that also provides a disconnect with the community. And anytime there's a disconnect, there is a failure to provide adequate resources and a failure to restore and recover. I can tell you that I was just on the phone with a friend prior to my deployment for Hurricane Ida, and she mentioned that 8 men showed up at her door, which is located, her home is in an African-American community outside of New Orleans. 8 white men showed up, 2 with guns. And she hung up the phone, and I called her back and I asked, who was that on the phone? And she mentioned that it was a search and rescue team. Now, in a location like Louisiana, where there have been significant problems with law enforcement and the mistreatment of African Americans, it would seem to me, and probably to anyone else, that it's not a good idea to show up at the door, 8 white men, 2 with guns. That is cultural competence, a failure to provide that cultural competence and respect. And that is disturbing. We can't just say that it's a disaster response, anything goes. That is not the case. Cultural competency and cultural sensitivity is required even in times of disaster, even more so where people are experiencing mental trauma and distress. And when we're dealing with disadvantaged communities and underrepresented communities, that consideration is not provided. So yes, cultural competency is needed and it must be present within disaster response and recovery. Thank you.
Mr. Kerr.
Thank you, sir. I agree with what's been said that cultural competence is huge. I mean, we've seen this play out in other areas. I'll give you an example. For example, tribes. Over the last few years, we've made a number of recommendations to FEMA, both during prior disasters and COVID, that they do a better job of outreaching with tribal nations on disaster assistance because they have unique needs And the truth is that all vulnerable communities have extremely unique needs, as Ms. Willis just said, that you have to factor in if you want response and recovery to be effective and you want to be able to use the programs we have. So I completely agree that that's important. One thing I'll say on the Red Cross issue is that oftentimes challenges come up with during a response phase, and we learn that maybe we don't have the right resources we need in the community. In my opinion, there's really no excuse for that. We have time, and there's so many efforts between the federal, state, and local level on the preparedness side before a disaster happens that we can work these issues out beforehand. We don't have to be surprised when they happen in a response. And I think that's something that should be looked at during blue sky days, so they don't pop up when there's a disaster.
Mr. Joseph.
Thank you, Mr. Chairman. In short, I would say yes, it is important that we have more cultural competency training and education. I'm proud of the work that while at FEMA, we were able to do with the Emergency Management Institute to provide and integrate into all training classes the types of training that you're talking about. We did that under the leadership of our former administrators and our then Chief of Staff, Eric Heiberger, to bring that importance highlighted in all the training that's delivered to state and local emergency management agencies. But I also think there needs to be more. We can continue to do more, not just with state and local agencies, but within the systems within the federal government that exist as it is. Thank you, sir.
Thank you very much. Chair recognizes the young lady from Florida, Ms. Dimmons, for 5 minutes.
Mr. Chairman, thank you so very much, and thank you to the witnesses for joining us today. On September 10th of 2017, Hurricane Irma made landfall in the Florida Keys and left a path of damage across Florida. In Florida, we certainly understand the life-threatening conditions of major hurricanes, and the National Hurricane Center estimates that 6 million residents evacuated from coastal areas ahead of Irma's landfall. Still too many Floridians needlessly lost their lives. We are told that over 400 nursing home residents died from heat-related conditions after their facilities lost power and did not have generators to power air conditioning units against the early September tropical heat. This question is for all witnesses or any of all who want to answer, understanding that the Department of Health and Human Services and state healthcare agencies play a significant role in regulating health and safety standards for nursing homes and other facilities. Has FEMA provided adequate guidance or any guidance to states and local governments to prepare for disasters impacting such facilities, and where can they improve? That's for any witness who would like to answer.
Madam Congresswoman, I'll go first. Having been a local, state, and federal emergency manager, yes, there is guidance. Most of it comes from Health and Human Services. I think what needs to be improved upon more, because as FEMA works with the states on what the gaps may be in their plans in advance of a disaster, there needs to be more integration of the emergency management and the healthcare emergency management structures. I think we saw that play out over the last several years in the pandemic response. There's areas of great success across every level of government where emergency management and healthcare worked well together. There's also opportunities for improvement, several of them that we've seen over the last several years. So I would say, yes, there are efforts of planning that are there. There could be more exercising, there could be more coordination. There is always the question that comes up of, well, who is in charge? And ultimately, it doesn't matter who's in charge. As an emergency manager, I was never the director of anything. I was the coordinator of things. And that's what we need to focus on in emergency management, coordinating all those efforts together for the greater good of the people we serve.
I really appreciate that answer, and I thank you for understanding that you're right. It's about protecting people during tough times, and certainly in Florida, we're still in the middle of hurricane season. So are we better prepared now than we were in 2017? Anyone else who would like to answer this question, because it is about being prepared? Anyone else?
I just wanted to thank the representative for this question and bringing this issue to light. and sincere condolences for the loss of life in 2017, and critical to recognize that also in 2005 in Hurricane Katrina, that we also saw the exact same thing play out with some of the most frail and vulnerable older persons in our society perishing in nursing homes and other assisted care facilities. And so this is a crucial issue. And I think FEMA adding the disability coordinators, for example, in the different regions, again, it's one step forward to draw attention to the issues of persons with disabilities, the elderly, people in institutionalized settings. But the fact that people in your state died in 2017 in the same way we saw in 2005, and that we may see again in future disasters, this is unacceptable. And this is where breaking down those barriers across agencies, putting resources toward those who get hurt first and worst in disasters, this is where the reality really comes to light. Thank you.
No, thank you as well. And how can we, as members of Congress, how can we help or assist to make sure that we are better prepared now than we were in 2017 and 2005? That question goes to anyone who needs to answer the question, because we can't get behind this. We've got to stay in front of this and learn from the tragedies that we've seen. Anyone else can answer that question for me?
Yes, ma'am, I will. Chauncey Willis here, and I would say that one of the key points to mention is more diversity and representation is needed within the field of emergency management. I too experienced Hurricane Irma, where I led the recovery for our city, Tampa, for that terrible hurricane. And you're right. Health and Human Services, public health, the health and medical system, there is a disconnect with emergency management. And unfortunately, there's disproportionate impact amongst the lower income and those who are minorities who are living within those facilities. It's unfortunate, and a lot of our emergency managers are not from diverse backgrounds and do not identify with the levels of diversity seen within their communities. So we've been advocating from our organization the use of social determinants of health paired with emergency management vulnerability assessments. The way that we do emergency management, the way that we integrate the other critical functions must be reviewed and in some cases modified.
Thank you. Finally, Mr. Curry, anything to add?
In terms of being better prepared from FY17, I think one thing that we often find in our work is that after a disaster, all sorts of after action reviews are done at the local, state, and federal level. And they typically identify a lot of gaps, not just the things we saw go bad, but the things that could have gone bad. But you know what? We don't follow up on those gaps later because the disaster is past and we just want to forget it. And it's hard because the resources are required to follow up on gaps. So I think to answer your question as a member of Congress, I think you can push folks in your state and your district to really follow up on those gaps so we don't have the problems that we know are going to happen when the next disaster happen.
To all of you, thank you so very much. Mr. Chairman, I yield back.
Gentlelady yields back. Chair recognizes the vice chair of the full committee, the gentleman from New York, Mr. Torres.
Thank you, Mr. Chair. The National Low-Income Housing Coalition has reported that FEMA interprets the non-discrimination clause in the Stafford Act and civil rights law to mean that the agency cannot provide tailored assistance for disadvantaged communities. I find FEMA's interpretation to be an anomaly because there's ample precedent for the federal government providing tailored assistance to disadvantaged communities and doing so within the boundaries of civil rights law. And FEMA's misinterpretation has arguably led to racial inequities in the disbursement of housing assistance. Research has shown that the lowest income homeowners receive half as much assistance as higher income homeowners to rebuild, and lower income applicants were twice as likely to be denied FEMA housing assistance due to, quote, insufficient damage. So my first question is for Ms. Willis. What actions should FEMA take to radically reduce the racial inequities that have arisen in the disbursement of FEMA funding?
Thank you for that question, Representative Torres. And I would like to state that FEMA has created some policies that are inherently inequitable. And as we discussed today, a lot of those policies are impacting the most vulnerable and historically marginalized communities the most. Within our written testimony and here today within our verbal testimony, we've been outlining different recommendations that we feel would be critical. One of the recommendations would be to reframe and consider new definitions for impoverished communities. We need to understand that that definition does not take into account the impact on communities such as population growth, economic indicators, financial conditions, and wage stagnation, also climate impacts to the community. All of these things, including resident demographics, must be considered. In addition, we would recommend that population limit be adjusted from 3,000 to 25,000 or 50,000. And we would recommend that more demographic data be added to the definition to clearly define what community indicators demonstrate economic distress prior to and during and after disasters. Thank you.
Thank you, Ms. Willis. I have a second question, and I'll start by way of analogy. A 2018 report by the Brookings Institute found that implicit biases in appraisals led to a systematic undervaluation of Black homes compared to similarly situated white homes. It found that the typical Black home is worth $150,000 compared to $230,000 for the typical white home. It found that Black homes in Black majority neighborhoods are appraised at a level 23% lower than white homes in white majority neighborhoods. And it found that Black homes on average are undervalued by $48,000, which translates into a cumulative loss of $156 billion. Are you concerned that the implicit biases that distort home valuations could be the same kinds of biases that could potentially distort FEMA home inspections?
I am. And that's an excellent point to make. The people that are appraising these properties are the same people that we see and that we live with day to day. Many of them bring their bias to the table. They bring it to the job. They bring it to their volunteer response. And so when they're evaluating properties, when they're determining value for properties using, in some cases, a cost-benefit analysis, they always undervalue the homes that are located in lower-income neighborhoods or that are housing African Americans, Latinos, or even our tribal nations. And it's unfortunate because their internal inherent bias impacts their ability to provide an unbiased, objective response. And in many cases, they are outright denying assistance to many homeowners. And so that's unfortunate. And yes, that is something that must be examined very closely. And I believe the data has already shown that this is the case.
And I share the concern, just like an appraisal with an implicit bias can lead to undervaluation, a home inspection with implicit bias can lead to underfunding by FEMA, and it's an area that we should explore in greater detail. Mr. Curry, do you have any thoughts on the persistence of racial inequities in the disbursement of FEMA funding and how to best address them?
Well, I think Ms. Willis talked about a lot of these, but on the home inspection issue, so we know from the data that the primary reason for denials for individual assistance from FEMA is what's called insufficient damage. And that is a very, very broad term that is completely reliant on the inspector's decision based on the inspection itself. And so what you said is right. It's up to the inspector, but also the other thing to factor in there is that, the inspections are done consistently for everybody. So, a hole in somebody's roof that has zero savings and no insurance is a lot different for a hole in somebody's roof that has savings and has insurance. The second person can fix that hole easily. The first person may never be able to fix the hole. And the hole in the roof leads to secondary level damage and problems down the road and mold and things like that. It's a domino effect. So while I think FEMA has tried, and this gets to the first part of your question, they've tried to be consistent for every single person, do things in the same way. that doesn't mean that that doesn't lead to disparate outcomes for different people.
My time has long expired. Thank you, Mr. Chair.
Well, you're very kind. You know, somebody recognized that time. Thank you very much. I ask unanimous consent to submit for the record a letter from the Board of Supervisors of Leflore County, Mississippi, on the devastation from the Delta flooding, a statement by the National Low Income Housing Coalition, and a 2019 NPR article entitled How Federal Disaster Money Favors the Rich. Let me thank the witnesses personally for their testimony and the members for their questions. Clearly, some of the things outlined here today, I'm convinced that a conversation with the FEMA administrator and others we can resolve, but others, I think, in conversation with the ranking member, we're going to have to produce some legislation. But your testimony has made our job much easier because many of the things you brought to highlight here today are things we've been talking about internally among staff and ourselves. So I want to thank you very much for that. The chair reminds members that the committee's record will remain open for 10 business days. Without objection, the committee stands adjourned.